this is Group 4's presentation of interventions to reduce cognitive decline and prevent dementia in community-dwelling older adults. We've listed some statistics here that by the year of 2023, 1 in 6 people will be the age of 60 or older, and that patients that are of the age of 65 have up to a 50% chance of developing delirium while being in the hospital. And we've also seen that delirium and dementia are directly associated, that if you've had an episode of delirium, you have a potential of developing dementia, and that there's a 31% risk if you've had delirium that after that episode of delirium for 5 years you could develop dementia. For risk factors, early detection is vital to planning your care when it comes to dementia, but can also help navigate for better care and management to potentially slow progression. Risk factors include cardiovascular risk factors, clients over the age of 65, the diagnosis of dementia or dementia-like diseases in the family, history of head injuries or traumas, and even the abuse of certain substances such as alcohol, drugs, nicotine, tobacco have all been linked to dementia. A review of 82 studies shows that targeting modifiable risk factors with non-drug interventions can improve cognition, reduce hospitalizations, and caregiver burden, though outcomes vary and long-term implementation remains limited as dementia cases are projected to triple by the year 2050. Another study also found that practicing mindfulness-based interventions such as yoga and attention to breath while laying down or sitting in older adults improves stress levels and emotional well-being, which indirectly supports cognitive health. Another notable study showed that daily physical activity can reduce and prevent brain inflammation. Brain inflammation is a key indicator to identify cognitive decline and is associated with neurological diseases such as dementia and Alzheimer's. Exercise activates microglia, a brain cell that aids in the neurological immune system and examines for damage or inflammation. When exercising, the action of moving activates these cells to make pro-inflammatory molecules that help fight infection, damage, and inflammation. Microglia also directs neurogenesis, the process of creating new nerve cells in the brain that also is directly connected to areas in the brain in charge of memory and learning, directly impacting how the brain communicates to the body. Overall, this contributes to decreasing the risk of neurological disorders and protecting brain health by reducing neuroinflammation. The impact of a nurse's role contributes to reducing cognitive decline and prevention of dementia varies in many ways. Establishing a relationship with the patient not only builds trust, but allows you to learn about their person, making early detection more achievable to promote prevention and early intervention. Using measurable tools and scales helps assess the progression or regression of the client and their condition, while collaborating with the patient promotes health regimen compliance and adherence. As nurses educate patients to implement physical activity in their daily schedule to increase blood flow to the brain and improve their brain health, playing music and putting puzzles together to improve the patient's cognition can also help to reduce anxiety and promote calmness. Putting patients in a calm and familiar environment will help reduce anxiety as well as confusion. Medication compliance will help manage symptoms by improving their memory to be able to maintain their daily activities. The medications will not cure, but can help manage symptoms. Lifestyle modifications such as getting adequate rest, eating a heart-healthy diet, and managing cardiovascular functions such as attending frequent checkups, medication compliance, and exercise will help delay or prevent dementia. Not every patient is the same. Tailoring activities specifically to the patient's needs can establish structured routines, maintain independence, and ties back into helping reduce anxiety, agitation, and promoting neurological health and maintenance. Here are our listed references, and thank you so much for watching.